What age would you recommend that I started getting? There's no prostate cancer in my history in my family. What age would you recommend that I started?
The new recommendations suggest that we start at 55. We used to start at 50, so between 50 and 55 and up to the age of 70. And if you have very good health, we might want to go longer than 70 to check for prostate cancer.
To me, 55 is, I'd sort of want to get started at 45 or 50 if I was advising somebody. So why do they wait till 55? Because that's when you get the best results.
Well, no, there's a lot of controversy with PSA, and we might find a lot of prostate cancers that are early and indolent, meaning that they're not going to cause any problems at all. And a lot of prostate cancer won't cause problems in a man's lifetime. So we might be over-diagnosing prostate cancer by checking younger men. So if you have a family history, if you're a black male, you probably should be getting checked at age 40. A lot of people, most people are going to get checked at 50. Again, the new recommendations suggest 55. Again, controversy with that, and I agree with you. I think I'd want to get checked. I've been getting checked since I was 40.
So should you always get both? When you get started, when you get a PSA, you should get a digital rectal exam called DRE.
Right.
I like those mnemonics like that type situation, and that can pretty much tell the doctor if he needs to investigate further. Now,
Right.
if there is benign, the prostate is enlarged, and the PSA is up, that could be just due to the enlarged prostate. Doesn't mean there'd be cancer.
That's right. It doesn't mean there's going to be a cancer, but there could be a cancer. And so if the PSA is elevated, then we may want to go ahead and do a biopsy, and just to make sure we're not missing something. And then after that, we can follow that PSA. If it continues to rise, we may need to do another biopsy at some point. But if it stays fairly stable, even though it's elevated, we may not be as concerned.
Might there be harm if somebody had an elevated PSA and their prostate was enlarged to say, well, let's get another one in 4 months and see if it's getting higher and higher, or it's better to get to work right away? If you find it, get to work, don't mess around.
It depends on how high the PSA may be and what it had been in the past. So if this is your first one and it's significantly elevated, you may want to check it again in about 3 months to see if it continues to rise. If you've had a very low PSA for a long time, then all of a sudden it jumps up, then you may be more likely to do the biopsy.